Gentry. I've had Tourette's since I was 5 years old, when I was first diagnosed with them. And I found out about this thing Dr. Sims does. It's a mouthpiece that shuts off a nerve and is supposed to reduce them. I've had my main symptoms of Tourette's have been shaking my head is the main one. I've squinted my face. I've different body jerks, and I've dealt with it for my entire life. And I met someone in Washington D.C. who pulled out a mouthpiece, and the second he took it out, his Tourette's got much worse, and when he put it back in, it got a lot better. So we did more research on it, found out where it was, came here, and one of the things Dr. Sims did was he looked at my MRI, and he noticed that, I don't know the science behind it, but something was off up here. And he stacked tongue depressors on top of each other, and we tested each side. And when I had them on the left side, there's about 10 of them, about that high, they taped together. And when I put them on the left side, my Tourette's were a lot worse, and it was pretty obvious that it was intensifying them. But when he put it on the right side, which was his original hypothesis that on the right side, with the modified, they'd be a lot better. It was true. When I had it on the left side, I ticked 14 times in 1 minute, and on the right side I ticked 3 times in 1 minute. So it was definitely clear that the tongue depressors were changing something and were helping dramatically. And that's where we are now, and I'm going to get the mouthpiece in 2 days, and we're hoping for the best.
Good, good.
Is that what that was?
That's good. Excellent. Because, you know, that's all we need to hear. Where you from?
I'm from Fort Smith, Arkansas. Came out to Maryland first time here. Really like it.
And you're a what fan?
The Ravens fan.
There you go.
There you go. Some people think that we came here to act, and to act like what we're doing was true, but I can guarantee you, if you live with this syndrome, you know it's no acting, it's real life stuff, and real life relief is would be pretty revolutionary, and that's what we're here to do. I sat in front of it, I was 2 feet away from a kid who pulled it out of his mouth, and that second his tics were just really bad, and the second he put it back in, they cut off. It looked like magic. We're not actors, we're not here to endorse anything, we're here to get help, and that's exactly what it does.
Where'd you see this kid?
I met him in Washington, D.C. at a Tourette's Syndrome Association public speaking seminar. I met him, and he showed me himself and his mom did what it was, told me where I could find it, and I just went from there and looked him up online.
Cool. All right, so we're going for it, right?
We are. We're all in. We're going to see if it helps. We're pretty sure it will. We have full faith in it. Full faith in the science and the technology.
Good deal. All right. Yeah.
My name's Evan Gentry, and I am getting my appliance today. We tested out with the tongue depressors stacked on top of each other, and on the right side of my mouth, the amount of tics I would have in a certain minute. With 5 in, with 0 in, I hit with 17 ticks in a minute. With 5 in, it was like 10. With 6, it was 3, and with 8, it was 4. And I have my appliance here, and the second I put it in, the second I put it in, it just relieves me completely. It's really incredible. It's really exciting. Like you can tell, it's kind of hard. It's going to be difficult learning to talk, but it's definitely a sacrifice I can make, going from 17 ticks and then to 3. So it's very exciting. The ticks don't go away completely, but they're definitely a big. They're decreased by a lot, and it's really exciting.
How about the intensity?
The intensity I lowered too. With my mouthpiece out, my tics would be really violent and really hard and just really intense. And with it in, they're very mild. They're a lot milder in number and in intensity as well.
Good. Happy you came?
I'm happy I came. It was worth the trip. I can't explain it like that. Just I want to throw away completely. It's really awesome. It's life changing. It's definitely life changing.
Now,